Well, good afternoon. It's a great pleasure to be back here after 24 hours. I'm Michael Rawlins. I'm chairman of NICE. I've been chairman of NICE since it started in 1999. But as you're probably aware, Britain is preoccupied at the moment with the general election. Nobody has any idea what the results are going to be. But we do know that all three political parties are very supportive of the National Health Service, and we also know that all political parties are committed to continuing to support NICE, the little organisation that I helped set up. NICE is fundamentally concerned with trying to improve the quality of care for NHS patients. But we have to take resource constraints into account. We have to take into account the fact that we have a limited budget for healthcare, a budget that is decided by Parliament every year, and we have to make the best use of the money. And we have to always remember that if we spend a lot of money on a few patients, we will deprive many others of cost effectively. It's a tough business, and it doesn't always make us popular. We have two main programs. Well, we have about 4 or 5, but the two that I'm going to mention very briefly. First of all, we undertake what we call technology appraisals. That's looking at the clinical cost effectiveness of individual technologies, predominantly pharmaceuticals, but it also includes devices, diagnostics, and so on. And when we look at them, we, as I said, take clinical and cost effectiveness into account. And so sometimes we have to say, I'm very sorry, this intervention is just too costly for our healthcare system. Contrary to what you might believe if you read the Daily Mail in Britain or the Wall Street Journal in America, we actually don't say no very often. It's about 1 in 10. So 9 out of the 10 things we say yes to. The second program that we have that is very important, and in fact in many ways the most important, is we produce clinical guidelines. We produce clinical guidelines on the management of conditions, not just by use of a particular drug, but conditions. Antenatal care, schizophrenia, breast cancer, which of course includes drug, but includes many other facets. Again, we have to take into account clinical and cost effectiveness. Our guidelines program is probably the largest program in the world. We've produced over 100, we've got over 60 in development. They're big pieces of work. It takes us about 2 years from start to finish. And they're done largely for us by a consortium of Royal Colleges, the Royal Medical Colleges. So this isn't government or even me saying this is how patients should be treated. Guidelines are developed, broadly speaking, by my clinical colleagues. We are also, particularly now, very keen on giving advice to the National Health Service on what we call disinvestment opportunities. We are facing, as most countries are, real financial problems, and we're used to use our resources in the most optimal way, and we need to stop doing things that are unnecessary, or we must start doing things that are obviously in the long term going to be saving. For example, the wider use of drugs to treat high blood pressure will have an immense impact in the years ahead and save money, save strokes, heart attacks and so on. Measures to prevent venous thromboembolism, clots in the legs, and people having operations, or just people coming into hospital for medical causes. We have to spend, but we also save substantial sums. We can save over, getting on for £130 million a year by doing much fewer tests before patients have operations. These otherwise quite healthy people, there's no need to do chest x-rays, ECGs, blood tests, completely unnecessary. So we're promoting that. And we're also promoting things like endometrial ablation, destroying the lining of the womb for women who with heavy periods, because it saves them having to go through a hysterectomy, which normally is 7 days in hospital. Endometrial ablation can be done as a day case. It will save about 40,000 hysterectomies a year. Very important for women. We are also very keen to, sorry, I picked up a filthy cold on the way around. We're also very keen to to support the environment for the life sciences industries, particularly with the Office of Life Sciences, and NICE is actively involved in something called the Innovation Pass, which is a mechanism for companies with very innovative products that aren't yet mature enough in their evidence for a formal rights appraisal, but to be used in the National Health Service and collect evidence over the appraisal. We're also very conscious of the need to improve the environment for regulation and governance arrangements for clinical research in Britain. And just before the general election, the Prime Minister announced that he had asked the Academy of Medical Sciences, which is the equivalent of the Institute of Medicine in Washington, to examine and review the arrangements which the Prime Minister himself recognised had become overburdened. I've been asked to chair the review, and we'll be looking at the regulatory and governance arrangements for experimental medicine, for clinical research, for clinical trials, and also for epidemiological type studies as well. We recognise that the regulatory environment with the European Clinical Trials Directive, the dreadful good clinical practice that was negotiated many years ago, is stifling research. And we also are aware that the governance arrangements in the National Health Service are counterproductive. So we've got to try and get through all this. I mean, I think we'll find ways in the National Health Service. To what extent we'll be able to influence Brussels and the European Clinical Trials Directive remains to be seen. Those of you who have experience of trying to do clinical trials in the UK, please do tell me where the problems have been, because I want to know. And if you've got some good ideas, oh bless you, thank you very much. If you've got some good ideas for what we can do better, also please let me know. The evidence, the date for evidence, submitting evidence is supposed to be the 1st of June, but if you want to wait a bit longer, that's fine. We will look at it whenever you. We're producing a report at the end of the year. We know that all three political parties are behind this endeavour, so it won't get kicked into the long grass. It's something we can really do. So thank you very much. Have we time for questions? Do we do questions, or do I get off my soapbox?